Good afternoon, Casey. So 5 deaths in Victoria, but overall, things are looking better.
Yeah, afternoon, Roz. Things are looking better. 5 deaths in the state. And not all of those actually occurred in the past 24 hours. 3 of them have occurred. 3 families are grieving a loved one that they've lost in the last day. The other 2 from previous days, much like yesterday, when 33 of 41's deaths yesterday occurred prior to last Thursday. We've seen a couple more that had been undercounted, hadn't been counted in the total number of fatalities added today. So that means we've gone from 8 in a 24-hour period yesterday to 3 today. That's a really good sign. We hope that holds up as the numbers of hospitalisations continue to drop as well, now down to 421 people in hospital in the state. Aged care infections as well starting to decrease in new number. We're sort of seeing less than 20 or so on average every day. The number of overall infections, 70 today is the number, down from 73 yesterday. So this general downward trend is continuing. The one little note of caution that the Chief Health Officer did sound today is that there were relatively few test results received. Those testing numbers have been lagging a little bit lately, just 10,000 in the past day, and that is down on where you'd like it to be. And Brett Sutton says there is more respiratory illness about in the community than just that. So hopefully those numbers improve, but the trend itself still all looking very much in the right direction.
So Casey, what do you make of the numbers out of Queensland today? 1 health worker has contracted COVID-19.
Yeah, it seems like the most likely source of infection for them is from the COVID ward they were working at the Ipswich Hospital. A nurse has been infected. That's one of Queensland's 2 cases today. The other, a school student, the second in their school that has now been closed for cleaning since Sunday, and every student there is being tested. So we're still seeing these cases cropping up, and as we've seen in Victoria, healthcare workers can be vulnerable to this virus as well. Hopefully that won't turn into a bigger cluster at the Ipswich Hospital. Elsewhere in the country, we've seen 13 new cases in New South Wales today. 11 of those are locally acquired. That is significantly higher than yesterday's 4, and all 11 of those have been linked back to known sources. You can see the spike there. So 11, 7 of them linked to this Sydney CBD cluster, so the numbers are back up in that cluster, and then a handful in other settings as well, including 3 at a school. The exposure sites, the places where people should be cautious or monitoring for symptoms, has grown as well. We've seen cases appearing in the inner west of Sydney, in Newtown, where we haven't seen infections in a little while. Exposure sites in a little while there, some in Marrickville, but not too many. So that's another slight concern. And those 13 cases, 11 locally acquired today, come with a day where, again, not all that many tests were done. Tuesday's often a low day, so we had 14,000 yesterday and today. Hopefully, this is the weekly pattern, so hopefully those numbers go back up to what we're used to, more like 30,000 a day in the back half of this week, and hopefully there's no corresponding increase in infections.
Yeah. Overseas then, what's happening in Spain?
Yeah, what we're seeing at the moment in Europe, a lot of countries in Europe, but Spain is probably one of the worst affected one, is the definite signs of a second wave. Actually, let me come straight to Spain first, where we've got 462,000. Of course, Spain was a country that one of the worst hit early on in this pandemic, got numbers under control. We're seeing this steady increase. Now, these very big ones, I should just point out, Spain is no longer reporting infection numbers on weekends. So that means every Monday in Spain we get a big number that is actually 3 days worth of cases. But we are seeing days now, ordinary days, where we're getting to almost 10,000 cases a day in Spain. And that is as bad or worse than the worst day of the first wave of this pandemic. And this is a pattern we're seeing across Europe. Let me show you this chart that I mistakenly showed you earlier, which has a number of European countries. What we've got here is Spain. Clearly you can see the height of that first wave, and we're getting to numbers like that again in Spain, but also France, 5,000 infections a day at the moment, and a couple of other countries, Germany and the United Kingdom, starting to see increases as well. And of course all of these waves in Europe absolutely dwarf Australia's second wave.
Casey, thank you.